and explain what you do at Community Health Alliance?
Yeah, so my name is Jenny Ayala. I'm a behavioral health provider. And aside from providing just traditional mental health therapy, I also work within the Healthy Living program. So I meet with children and their families and just check in on their relationship with their bodies, their relationship with food, and assess their motivation to just build healthier habits.
Awesome. And so during Obesity Care Week, we wanted to cover certain themes. And so I thought you would be a perfect person to talk about the experience and the work that you do at Community Health Alliance. And so I really thought a great question to ask is like for you to explain what weight stigma and weight bias is, and maybe if you could provide an example of something that you've seen or anything like that.
Yeah, so weight bias is the negative judgment, the stereotypes, and the stigma that is aimed at people because of their weight. So some traditional examples are like, typically people that struggle with obesity get seen as people who are lazy or just lack willpower or don't care about their health, which, from my experience, couldn't be further from the truth. I feel like they are more influenced by healthy eating and are trying to just look at their diets a lot more than the typical person. And I think with kids, we see it all the time in teasing and in bullying.
Mm-hmm. And so when a patient is experiencing bullying regarding their weight, how do you approach that?
Yeah, so in the beginning, I always want to remind them that the bullying, it's not their fault, it's not their body's fault, and it usually has nothing to do with them. It usually has to do with the person who is being the bully. And then I work with the parents to advocate for their child. So if the bullying is happening at school, to begin a report within the school. And if it's happening somewhere outside of school, to address it, whether it's coming from an adult, a family member, or another child in a different setting, to actually work to address that. And then, if I see them ongoing, we're always going to focus on just building confidence, practicing gratitude for their body, and then focusing on health rather than their appearance.
So do you have like a certain go-to resource that you use with these patients?
Yeah, so the resource actually, Dr. Shane shared it with me, and it's the Yukon Red Center for Food Policy. And they have a ton of research on weight bias and just kind of dispelling the stigma and practicing body inclusivity. So they have a ton of resources for kids, for parents, for teachers, and they have like cool pamphlets and handouts that they can provide.
Nice. And so do you find that it's sometimes difficult to identify a patient who might be experiencing weight stigma in terms of like they don't want to talk about it, or maybe if you're dealing with like a pediatric patient, they don't want to talk about it in front of their parents?
Yes, that happens all of the time. And I think it's because we all just want to be seen as strong and confident, even when we're not. So it is important to have like a really honest conversation, sometimes a one-on-one conversation about how somebody feels about their bodies. And I think with kids, it's hard for them to talk about disliking themselves or disliking their body in front of their parents, because they think it's going to hurt their feelings.
Definitely. I feel like it's difficult to talk about our bodies with anyone, especially our parents. But I think even just, when you're trying to build a relationship with your therapist or, if it's their first or second visit with you, I imagine it's more difficult for them to talk about how they're experiencing bullying or how they see their own bodies, etc.
Yeah, definitely. And it's so crazy. It's one of those things that so many of us struggle with, but nobody wants to talk about. So I think
Right.
the more that we talk about it and the more that we are honest about how we feel about our bodies, the easier it will get for kids to talk about it. And I've actually seen medical providers and myself, use ourselves as examples like, oh, I think this about my body, or I think this about this body part, to just kind of start that conversation.
Yeah, and that's definitely like showing that like you're human and it also you experience it even though there's a different dynamic of you being the therapist and them being the patient. So I think that's awesome. But great, thank you so much for sharing. I think that this was perfect.
Thank you so much.